It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers. And the question last week was, why would a critically ill patient in an induced coma need a tracheostomy in intensive care? You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is, my husband hasn't been waking up for the last 2 weeks after open heart surgery, and he remains in an induced coma in intensive care. Is this normal? This question from Erin is an excerpt from a phone and Skype one-to-one counselling and consulting session with me. So, Erin describes her husband's problem as follows. Hi Patrick. My husband has been in a medically induced coma after open heart surgery. He's had 3 bypass grafts for now 14 days. During this time period he had only responded minimally to commands on a few occasions. Me and my family have been wondering if this is normal and how long it could take for him to wake up. My husband is 64 years of age and generally speaking in good health. He had to have cardiac surgery because he had angina in the last 6 months, and he was getting short of breath all the time, and he could barely get up the stairs in our house because he was getting exhausted quickly. He had a stent put into his heart about a year ago, but his angina has gotten worse again even with a stent. Initially, in the first 24 hours after he had the heart surgery, he developed severe bleeding and he had to go back to the operating theatre for the bleeding. During his stay in intensive care in the next 24 hours, he required multiple blood transfusions, and he therefore didn't wake up because they kept him in the coma until he stopped bleeding. After about 3 days after surgery, they were trying to wake him up, but he wouldn't, and he was fighting the ventilator, so they had to put him back into the induced coma. It's now been 2 weeks and he still hasn't responded appropriately. Every time they've been trying to wake him up, he would fight against the ventilator, not breathe up properly, and then they have to put him back into the induced coma. They have done a CT scan of his brain, and the CT scan was fine and didn't show anything wrong with my husband's brain. Another issue he's dealing with is having high blood sugars, and he's now requiring an insulin infusion. The doctors have been telling me and my family that he will wake up, but he needs more time. Is this normal that it takes so long, and what can we do to help my husband? Many thanks, from Erin. So here's my response. Hi Erin, thank you for sending through your question, and thank you for using my one-to-one phone or Skype counseling and consulting service. It must be very difficult and frightening to watch your husband not wake up after 2 weeks after an induced coma for open heart surgery. I can see why you are seeking out for help, and try and find out how I can help you in this difficult situation. Now, waking up after 2 weeks after open heart surgery in intensive care must feel like an eternity for you, and I will put things in perspective for you. First of all, not waking up after an induced coma after open heart surgery or bypass grafts is happening very rarely, but it certainly does happen, and I have seen it in ICU a few times. Most of the time, if it does happen, it almost follows this sequence of events that you have described in your first email to me. Some patients, after they had open heart surgery, usually for bypass grafts or valve repairs or valve replacements, they often start bleeding and they then end up with needing multiple blood transfusions. Open heart surgery is high-risk surgery, and the risk for bleeding and going back to the operating theatre after open heart surgery is a real risk. Many patients who come back to intensive care after open heart surgery have been on blood-thinning medication, something like that's called anticoagulation, such as aspirin, clopidogrel or Plavix, or warfarin, because they have open heart surgery. Depending on when it's safe for the patient to cease the anticoagulant medication before surgery, it still comes with a higher risk of bleeding after the surgery. I'm sure your husband would have been on clopidogrel or Plavix before the surgery because of his stent, and whilst they would have stopped the Plavix or the clopidogrel before the surgery, it would have still increased the risk of bleeding manyfold. Therefore, the bleed after the surgery, the return to the operating theatre, and the delay in waking up don't come as much of a surprise to me. From my perspective and from my experience, there are three major forces at play that contribute to your husband not waking up after the induced coma. The first one is major surgery with an induced coma. That's a risk in and of itself. Number two, return to the operating theatre for bleeding, therefore another delay in waking up. And number three, massive blood transfusions to stop the bleeding. Again, massive blood transfusions have a tendency to slow waking up down after an induced coma. The combination of those forces are often what delays critically ill patients from waking up after an induced coma. The good news is that they have already done a CT scan of your husband's brain, and they have already ruled out any brain damage. Therefore, your husband is just taking his time to wake up. I will explain what that means in a moment. Let's quickly look at what most likely contributed as well to your husband's delay in waking up after the induced coma. When your husband wasn't waking up properly while he was fighting the ventilator, they most likely would have changed some of the sedatives. There is a high chance that he was changed from propofol to midazolam. Propofol is a short-acting sedative, and midazolam is a long-acting sedative. Normally, if it's expected that an induced coma is short-lived, propofol is the drug of choice, and for an ongoing induced coma, midazolam is the drug of choice. Especially if your husband was fighting the ventilator and he couldn't be woken up, there is a very high chance that they changed sedation from propofol to midazolam. This often helps with better sedation and also a smoother waking up, but it can also often dampen your husband's response, because midazolam is longer acting sedative because of its prolonged half-life compared to propofol. On top of that, your husband would have had morphine or fentanyl for pain relief. After all, open heart surgery is very painful and requires a fair amount of opiate drugs such as morphine or fentanyl. In normal circumstances after open heart surgery or bypass grafts, where patients don't bleed, come off the ventilator within 12 to 24 hours after surgery, and morphine or fentanyl are usually ceased and patients go on to lighter opiates such as endone, oxycodone, codeine phosphate, tramadol or Targen. Because your husband was staying in the induced coma, he would have continued on either morphine or fentanyl, and again, the combination of midazolam and the morphine or fentanyl can be so potent that a delay in waking up is almost inevitable. Therefore, even though 2 weeks is not a particularly long time in intensive care terms for an induced coma, if you see your husband unresponsive for such a period, of time it will feel like an eternity to you. Now, given that your husband had such big surgery, he will also take his own time to recover. Most critically ill patients in intensive care will take their own time to recover, no matter how much the intensive care team and families want to speed up the process. As a next step, what could happen is that the doctors might give your husband some either naloxone, which is a drug and an antidote for morphine or fentanyl. It basically can reverse the effect of morphine and fentanyl. Or they might give your husband some flumazenil, which is the antidote for midazolam. Again, it can reverse the effect of midazolam to help him coming out of the induced coma and wake up. If the intensive care team is still waiting for your husband to wake up without giving any antidotes for morphine, fentanyl or midazolam, then you may have to remind them of what you want them to do. As a rule of thumb and general advice, sometimes it's best to wait and see. However, the longer your husband isn't waking up after the induced coma, the higher the risk that he might need a tracheostomy, and that's something you, as well as the intensive care team, would want to avoid. Therefore, reminding the intensive care team of what can be done is probably a worthwhile exercise. It shows them that you're not afraid to demand things, and it shows them that you've done your own research. Furthermore, what you and your family can do is certainly to keep asking all the right questions to the doctors and the nurses, and by me advising you, they will very quickly see that you know what you are talking about. You have also mentioned that your husband is now on an insulin infusion for high blood sugars, despite not being a diagnosed diabetic. This is nothing uncommon for a critically ill patient in intensive care. Many patients in ICU end up with high blood sugars despite not being diabetic, and therefore have an insulin infusion, at least temporarily. The reason being is that a high blood sugar tends to be a stress response from the body during critical illness. High blood sugars and temporarily being on insulin is rather common in intensive care for non-diabetic patients, and blood sugars usually go back to normal after the stay in intensive care. Moreover, I would also advise you to talk to him when you are with him, just like if he was awake. There is a very good chance that he might hear you. Touching him, holding his hand, and just talking to him will help as well. I wouldn't advise you spending day and night in intensive care, because your husband will need you more when he's more awake and on his way to recovery. Sometimes it just takes time, and I have seen those situations before. However, if it's ongoing, the risk is getting higher for your husband needing a tracheostomy, and again, it's something you want to avoid. What's really important, Aaron, is that you take this advice and run with it. I have counseled many families in the past who don't use the advice that I'm giving them, and then they don't get the results. Just implement what I'm teaching you here and you'll get the results. Wishing you and your family all the best. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.